Actor Luke Perry and director John Singleton recently made headlines when they both passed away after suffering a stroke. A stroke can really happen to anyone, no matter your age or fitness level. Just ask Michael Johnson. He's the Olympic sprinter, also had a stroke just less than a year ago. Thankfully, he's on the road to recovery. Karen Rosnick spoke to both Johnson and Dr. Carolyn Brockington on the warning signs of a stroke.
Dr. Brockington and Michael, thank you so much for joining us today. And I'm going to start with you, Michael. We know you as the most decorated sprinter of all time. We could talk forever about your gold medals, but we're here to talk something really actually serious. Less than a year ago, you actually suffered a stroke. So can you describe what happened?
Yeah, it actually, kind of came out of nowhere, and I was just having a normal day. I just finished a normal workout for the day, and afterwards, a few minutes afterwards, all of a sudden I started experiencing some strange sensation in my left side of my body, on the left leg, loss of coordination, loss of strength, and tingling and numbness in my left arm. I ultimately made the decision to get medical help and go to the emergency room, and that turned out to be critical in my ability to recover and be here today, fully recovered and back to the level of activity, that physical activity that I enjoyed before my stroke. I was able to make the recovery because I sought immediate medical attention, and that was critical.
That's amazing, and Michael, we're so happy that you're doing so much better. But as Michael said, Dr. Brockington, stroke really doesn't have an age, or it really doesn't depend on your physical ability. Is that correct?
Well, what's interesting about stroke is that a lot of people do think that only strokes occur when you get older. So if you're young, should you really worry about it? And the truth is that stroke can occur at any age, right? We know that stroke means that not enough blood gets to the brain in a period of time and causes an injury to the brain. So there are many different reasons why that might happen. So age is not the factor that determines whether someone has a stroke. It's whether they have something that actually interrupts blood flow to the brain. So certainly you think somebody who's at the highest level of their health, how could they have a stroke? But it can happen. So as Michael said, strokes can occur in any age, and what we really want people to recognize is what are the signs and symptoms of a stroke, and then if you're having those symptoms, realize that stroke is considered an emergency and you need to go to the hospital right away. So you have to call 911. In fact, we have an acronym. We say we want people to act fast. So if you think of the word FAST, F-A-S-T, F would be for face. If suddenly your face is drooping, you may be having a stroke, so you need to go to the hospital. A is for arms. If you can't keep your arms straight, or if your leg's not moving, you might be having a stroke. S is for speech. So sometimes people will notice that their speech is garbled, or they're not speaking well, or they're confused about what people are saying to them. That might be a stroke. And then T is for time. We want people to realize that they have to call 911 immediately. This isn't time to Google. This isn't time to call your friend. It's time to call 911, because the faster you're able to get to the hospital, we're able to diagnose the stroke and treat appropriately, the more likely you will have a good recovery.
So doctor, what if you see these signs in another person? I know that sometimes they can be confused. Slurred speech, or even a droopy face can be confused with some other things. If you see it in another person, what should you do?
Right. Well, the key is that you're right. Many different conditions can cause maybe similar symptoms, but stroke being such an emergency, and we realize that time is key in terms of treatment, we want people to come to the hospital. It's really only based on some testing that we do in the hospital. We look at the brain, we do some blood tests, etc., and then you have an examination by a doctor who understands how the brain works in order to determine whether someone's had a stroke. So it's important to go there and make sure that that's the diagnosis. If it's not, then fine. But if it is, you've done the best thing you possibly can in order to improve your recovery down the line. So it's really important to go in right away. And then also prevention is important, right? We say that up to 80% of strokes can be prevented. And a lot of people say, well, how can that be? And how we do that is by identifying risk factors, identifying medical conditions that increase someone's risk of stroke over a period of time. So we know, for instance, that high blood pressure is the #1 reason why people have strokes. So many times if people have high blood pressure, they need to change their diet, lifestyle, sometimes medication. Diabetes is another risk factor for stroke, heart disease, obesity, smoking, also family history. So there are a lot of different strategies that we use also for secondary prevention. So someone who's had a stroke, they're at risk of another stroke. So what we use for secondary prevention many times is an aspirin a day, which is a good blood thinner. Cholesterol medicine sometimes may be needed. Sometimes people need medicine for heart disease or high blood pressure or diabetes. But again, this is the time to partner with your doctor, identify what your risk factors are, and then discuss what is the appropriate way that you can change your risk of stroke through lifestyle modification as well as diet, exercise, and medication.
So Michael, you're less than a year out from your stroke, so what are you doing actively as far as prevention?
So I'm doing exactly that. I'm working very closely with my doctors who have prescribed an aspirin for me daily, a cholesterol medication, and a high blood pressure medication. I'm taking all three of those medications every day and seeing my doctor regularly, and working very closely with my doctors, and then keeping all of the risk factors down, continuing to be even more diligent than I was before in maintaining my weight, making sure that my diet is balanced and nutritious, and making sure that I continue to be active, and then from there just going on and living my life, but trying to make sure that I really manage my health and be diligent in doing so.
Well, thank you so much for sharing your story. Doctor, quickly, is there any resources online that people can access to learn more about stroke prevention?
Absolutely. Your viewers can go to strokeassociation.org/stroke month to get information regarding what is a stroke, what to do to try to prevent a stroke from happening, and then what are the signs and symptoms of a stroke. So strokeassociation.org/stroke month.
Great, excellent information. Thanks again for sharing your story.
May is National Stroke Awareness Month. If you'd like to learn more about stroke prevention and how to identify a stroke in yourself or others, please visit this website. Go to strokeassociation.org.